Morning students. Today we are going to discuss Kuhs Community Medicine Paper 1 February 2018 answer key discussion. Since the questions are not in the screen, I will read the question. So it is February 2018. So February 2018, first comes the essay 10 marker question. It is said that no single method of control will adequately address the problem mosquitoes in all areas. In this regard, classify the different methods of integrated approach to vector control and describe clearly each method with specific reference to mosquitoes. So since no method adversely affect the problem, it is better to adopt an integrated method combining two or methods, significant integrated approach, maximum result with minimum inputs, prevent the environment pollution with toxic chemicals, prevent development of insecticide resistance. So there are many methods. First comes the anti-larval methods. Environmental control is by source reduction, that is filling, leveling, drainage of breeding places, QLEX, removal and disposal of sewage and wastewater, EDs, discard water holding containers, anopheles, proper drainage of freshwater collections, Mansonia, removal of the aquatic plants. Chemical control, we can use mineral oil, synthetic chemicals. Biological control, effective only when used along with other methods. Example, larvivorous fishes like Gambusia, GAMBUSA, Gambusia. Use of BT, Bacillus thuringiensis formulations. That will deal with the anti-larval measures. Now coming to anti-adult measures. Wide range of insecticides belonging to organochlorides, organophosphates, carbamates, synthetic pyrethroids can be used. Residual sprays, application of insecticide to surface so that insecticide particles remain on the surface over a long period like DDT. Then spray spray, insecticide spray to atmosphere in the form of fog or mist, ideal for rapid control of rapid control in emergency situations. Example, malathion. Then genetic control is cheaper, potentially more efficient, not subject to resistance. Example, sterile male technique, cytoplasmic incompatibility, chromosomal translocation, gene replacement exam. Then personal protective measures. So we can use anti-larval measures, anti-adult measures, personal protective measures, that is using mosquito net screening, and then repellents. Next question in that question paper is a 5-marker problem-based question. So the second question, with reference to the levels of prevention, describe the modes of intervention. So what are the levels of the modes of intervention? Primary prevention. In primary prevention, what we do is the health promotion through health education, environmental modification, nutritional intervention, lifestyle and behavioral changes. Then what do you do next is the specific protection. Then secondary prevention includes early diagnosis and treatment. Tertiary prevention is disability limitation and rehabilitation. Next question, problem based. Occupational health hazards are increasing in the industrial area coming under your PSC. As a medical officer, what are the steps you will take to control the situation? So what are the things you can do? Obtain a list of the establishments, that is survey or from labor department. Collect the data on occupational hazards like factory audits, disease register from clinics, disease notification. Identify the occupational problems. Implementation of appropriate remedial measures like from the LSG, the local self-government and labor department. Then monitoring and evaluation. The next question, short answer question, fourth one is the Bradford Hills criteria for judging the causality. So, in the absence of controlled experimental evidence, the criteria for causal association is absence of controlled experimental, temporal association, strength of the association, the specificity of the association, the consistency of the association, the biological possibility, the coherence of association. That is included under the Bradford Hills criteria for judging the causality. So, in the absence of a Experimental evidence criteria for causal association. Look for temporal association. How is the strength of the association, specificity of the association, consistency of the association, biological possibility, and coherence of the association. Then what are the functions of the family? Residence, there is division of labor, reproduction and bringing up of children, socialization, economic function, social care. Principles of health education. Credibility, message is trustworthy. Interest, only felt need would be interest to listener. Participation, active involvement. Motivation, awakening the fundamental desire to learn. Comprehension, matching the level of understanding. Reinforcement through repetition, learning by doing, known to unknown. Setting an example, practice what you preach. Good human relations, better relationship means better sharing of information. Feedback, leaders can change the agents. Then assessment of dietary intake, a method of nutrition assessment gathers information on dietary patterns and nutritional deficiencies. Direct assessment of food consumption involves dietary surveys, household survey, individuals methods, weighment of raw foods, accurate not practical, weighment of cooked foods not acceptable. Then oral questionnaire methods or 48 hour dietary recall, food frequency questionnaire, food diary, mean intake of each food items calculated and compared with the standards. Necessary action taken based on findings. What is the Medical Termination of Pregnancy Act 1971? MTP Act lays down the conditions to be satisfied to do MTP's medical, eugenic, humanitarian, socio-economic failure of the contraceptive devices. Persons who can perform MTP less than 12 weeks, 1 registered medical practice. 12 to 20 weeks, 2 registered medical practice. Can only in institution established and maintained by government or approved by government. Changes have been made in the 3 administrative areas approved by board. Qualification required to do abortion, the place where abortion is performed. Now is the differentiate between question. First is the difference between incidence and prevalence. So prevalence is all current cases existing at a given point of time over a period of time in a given population. Incidence, number of new cases occurring in defined population during a specific period of time. Numerator, new and old. Incidence only new. Duration, it is influenced by duration, not influenced by duration. Type, proportion, which is a rate. Assessment method, cross-sectional study. Incidence, it is through follow-up study. Polished, differentiate between polished rice and parboiled rice. Polished rice means it is bran is removed. Parboiled, specific process of parboiling. Nutritive value decreased by loss of fiber and nutrients. Glycemic index more. Nutritive values increase as the nutrients are driven into endosperm. Smell normal, maybe foul smelling. Parboiled. Shelf life increased, protection from insects. Then gross, differentiate between gross reproduction rate and net reproduction rate. Gross reproduction rate means the average number of girls that would be born to a woman if she experienced the current fertility pattern throughout her reproductive span, that is 15 to 44 or 49 years, assuming no mortality. Net reproduction rate is given the number of daughters a newborn girl will bear during her life, assuming a fixed age, specific fertility and mortality rate. NRR is equal to 1 or to 2 child no. And substantiate answer with reasons. Dumping. as a method of solid waste disposal should be outlawed. Cost and efficient methods are present. Public nuisance, environmental pollution is occurring. Water, vector breeding, flies, mosquitoes, rodents. 13th question, experimental studies are faced with more ethical issues than case control studies. RCT, randomized controls, there are interventions in the one group and no intervention in other group. In case control studies, outcome and exposure have already occurred. No interventions are involved. Listed the following 2 marker questions. 14th question is occupational hazards among agriculture workers. The zoonotic diseases, animal-borne diseases like leptospirosis, tetanus, TB, brucellosis, anthrax, accidents, toxic hazards like fertilizers and pesticides, bites and stings, snake, insects, contact dermatitis and other allergic disorders, physical hazards like heat stroke, musculoskeletal problems and respiratory disorders. The characteristics of a standard normal curve. Smooth, bell-shaped, perfectly symmetrical based on infinitely large number of observations. Total area under curve is equal to 1, mean is equal to 0, standard deviation is equal to 1, mean, median and the mode coincide. That is the standard normal curve, mean, median and mode coincide. The next question, chromosomal disorders related to sex chromosomes, any 4 in number. Klinefelter syndrome, XYY syndrome, Turner syndrome, super females. And this is the hemophilia type A and B, Duchenne type of muscular dystrophy, color blindness, G6PD deficiency, hydrocephalus, retinitis pigmentosa, A gamma globulinemia Bruton type, dominant X-linked is vitamin D resistant rickets, familial hypophosphatemia, blood group X. Then 17th, biomedical waste that should not be incinerated. Pressurized gas containers, large amounts of reactive chemical waste, silver salts and photographic or radiographic waste, halogenated plastics such as polyvinyl chloride PVC, waste with high mercury or cadmium content such as broken thermometers, used batteries and lead-lined wooden panels. Then sealed ampules or ampules containing heavy metals. Enumerate the methods to prevent air pollution. Containment, replacement, dilution, legislation, international action. So, containment, replacement, dilution, legislation, international action. Next question we will discuss in the next video.